Hey everyone, and welcome to this Urgent Explainer. Today, we're diving into something that's absolutely critical, yet surprisingly misunderstood in the world of healthcare regulatory compliance. We're talking about healthcare exclusion screening obligations and risk mitigation. Let's be real. If you're operating anywhere in the healthcare space today, treating compliance like an afterthought is a luxury you literally cannot afford. So, this explainer is designed to give you a crystal-clear, structured roadmap. We're going to make sure you understand your obligations, know how to execute proper screenings, and ultimately shield your organization from some massive financial and legal risks. Let's just jump right in.
Think about this for a second. Are you unknowingly paying excluded individuals with federal healthcare dollars? It's a seriously high-stakes question. Every single day, healthcare organizations just kind of assume their hiring processes caught everything. But what if a trusted vendor, a newly hired nurse, or even a third-party billing contractor is legally banned from touching federal funds? If they are, and you're paying them, you are sitting directly in the crosshairs of federal regulators. The risk of having inadequate screening protocols is severe, and the financial bleeding, well, it can be absolutely catastrophic.
Here is our roadmap for today's explainer. 1. Healthcare exclusion obligations. 2. Follow the federal money. 3. Databases and screening frequency. 4. Consequences of missed screenings. And finally, 5. Documentation best practices.
Let's start with Section 1, Healthcare Exclusion Obligations. Let's understand the threat.
So, what exactly is a healthcare exclusion? At its core, it's an absolute federal and state prohibition. It legally bars individuals and entities from participating in federally funded healthcare programs. We're talking Medicare, Medicaid, and TRICARE. And listen, this isn't just a friendly suggestion or a gentle warning from the government. It is a hard line. If someone is on an exclusion list, they cannot directly or indirectly provide services, order services, or even prescribe medications that are billed to these federal programs. Doing any of that is a direct violation of federal law.
Now, people don't just end up on these lists by accident, right? These exclusions exist for a reason. They're triggered by severe violations of trust and law, things like program fraud, patient abuse, licensing revocations, and controlled substance violations. It even covers financial issues, like defaulting on health education loans. Ultimately, the government maintains these lists to keep bad actors far away from vulnerable patients and, just as importantly, away from the public purse. It's really all about protecting the integrity of the entire healthcare system.
Moving on to Section 2, follow the federal money. This is the golden rule of compliance.
If you only remember one single thing from this entire explainer today, let it be this: follow the federal money. If an individual or an entity directly or indirectly receives federal healthcare dollars, they have to be vetted, no exceptions. It really doesn't matter if they're a frontline trauma surgeon or a back-end software vendor. If a single cent of Medicare or Medicaid money flows down to compensate them for their services, they fall straight under the federal screening mandate. And this rule applies comprehensively across your entire operation. Internally, yes, absolutely you have to screen your direct care providers and clinical staff. But it also includes your administrative staff and your billing, coding, and revenue cycle management teams. And externally, you are equally responsible for screening your contractors, your temporary locum personnel, and your referral sources. Your compliance shield literally has to extend outward to anyone touching your federally funded operations. All right, Section 3, Databases and Screening Frequency. Basically, where and when do you need to check? For this, you've got to rely on primary screening sources at both the federal and state levels. On the federal side, the absolute gold standards are the OIG's list of excluded individuals and entities, usually just called the LEI, and SAM.gov, the System for Award Management. But here's the catch. Federal checks alone just aren't enough. You also have to check state Medicaid exclusion lists, like the OMIG in New York or your specific regional OIG portals. Missing just one of these layers creates a massive blind spot in your compliance program. And this brings us to a huge trap where so many organizations fail terribly. Doing a simple point of hire screening is completely insufficient. The actual operational standard is monthly recurring screening. Why? Because exclusions happen continuously after someone is hired. Think about it. An employee could be perfectly clean on their very first day of work in January, but then have their nursing license revoked in March and pop up on an exclusion list in April. If you only check them at onboarding, you'd spend the rest of the year unknowingly billing the government for excluded services. So monthly screening is not optional. It's a strict, mandatory compliance practice.
Section 4, Consequences of Missed Screenings. Let's look at the financial, legal, and reputational risk.
Look, going to regulators and saying, hey, we didn't know, is simply not a valid legal defense at all.
Regulators don't view a failure to screen as some tiny little administrative hiccup. They view it as a complete failure of your basic compliance responsibilities. Ignorance offers literally zero protection. If your screening protocols were neglected, or if you just assumed someone else handled it, you are going to be held entirely accountable for the fallout.
And trust me, that fallout is devastating. A single missed screening can jeopardize the entire organization. We're talking about staggering civil monetary penalties, or CNPs, that multiply with every single claim submitted. Then, you've got the mandatory repayment of all billed services tied to that excluded individual. It can even trigger False Claims Act liability, which brings the terrifying potential for treble damages, meaning you have to pay back 3 times the amount of the original claim. And finally, the severe reputational damage and loss of trust with payers, partners, and patients, that can easily be a death knell for a healthcare business.
Let's wrap up the modules with Section 5, Documentation Best Practices, Proving Your Compliance.
You know the famous saying in healthcare, right? If it isn't documented, it's pretty hard to prove it happened. You must maintain time-stamped audit logs for every single monthly check. Step 1. Record exactly who was screened. Step 2. Log the exact date the screening took place. Step 3. Explicitly list the databases you searched, like the LEI, SAM.gov, and those state lists. And Step 4. Note all match resolutions and results. Like, if a potential name match popped up, how did you verify it wasn't actually your employee? That whole resolution process has to be recorded, because undocumented compliance is practically non-existent in the eyes of regulators. So, just to summarize everything we've unpacked today, having a strong monthly recurring screening process does way more than just tick a regulatory box. It actively protects patients from unqualified or dangerous individuals. It safeguards our public healthcare funds from fraud and waste. And fundamentally, it protects the operational and reputational integrity of your entire organization. Compliance is really just a continuous commitment to doing the right thing effectively and responsibly.
I want to leave you with one final, provocative question to take back to your teams today. If regulators walked in right now and asked for your screening logs, could you actually prove your compliance? Think about your internal staff, your vendors, and the very last time you ran a comprehensive check across all those federal and state databases. Please don't wait for an audit to find out your processes are lacking. Thanks for joining me on this explainer. Like, share, subscribe to Decode Healthcare with Harshal.